Horsemanship goes all the way back to probably the times when the Spaniards brought them here. And tribal people have always relied on the horse for burdens, we go in the mountains. It's so much easier to go in the mountains with horses than just carrying a big old pack. And that's just a perpetuation of horsemanship. And in my younger years, I saw guys that had extremely good horses, and it was a competitive thing. And of course, we have our traditional hunting excursions up into the high country, and that requires horses. There's quite a few people that have horses, and right now, for the younger generations, there's an educational component involved. We have handouts that, if they don't already know it or they didn't learn it from their elders, we'll certainly be glad to sit down and talk with them about what it takes to have a healthy horse. This effort began about 5 years ago through the War Chief's office. This Pueblo Animal Health Services approached the Pueblo about doing this kind of activity, and they're part of a larger organization called the Native American Veterinary Association. They're not necessarily Native American themselves, but that's the name of the organization. It's a nonprofit group, and there's veterinarians that come from different parts of the country. Some have come from New York, New Jersey, California, Oregon, Florida, and the Midwest. They volunteer their time, they pay their own way to get here, and the least we can do is provide lodging for them, and of course we feed them. And this year we were able to identify some resources and contribute a couple $1,000s towards veterinary medicine, because they always bring their own veterinary supplies. But we felt like since they're putting in their free time, the least we could do is buy some horsey medicine. And we're hoping to have another one of these later on in a year or two again, because horse care isn't just once a year. Anybody that takes good care of their horses knows that it's just not one time.
We are doing a free horse clinic. We are doing vaccinations, deworming. We will geld stallions that need to be gelded. We will do dental work, treat cuts and wounds, and just do a general health.
How often do you come out here to do this?
At least twice a year. We would like to go up to at least 4 or 5 times a year, depending on our organization. It's fully run by volunteers, so it's based on how many volunteers I can get to come out and give up their time and do their work for us for free.
What are some of the risks?
Right there. Obviously, you've seen horses act up. That's why we are very picky with who our volunteers are. They have to be very professional. They have to know how to get out of the way, know how to handle the horses and keep them calm.
And what in particular are you looking for with these horses?
Well, we've done a lot of herd health improvement. A lot of these horses, now that we're seeing them multiple times a year, are looking better and better health-wise. We're treating them for communicable diseases that they can spread both amongst themselves and to people. Right now there's a lot of issues with West Nile in our area, and horses can be a vector for that, so they are all being vaccinated against West Nile, which people can contract as well.
Mm-hmm. What sorts of advice are you giving some of the horse owners?
We're talking to them about their horse's health, weight, feet, just general ways of improving their horsemanship and how they're taking care of their horses.
But I think this is a wonderful, great service, and as you can see, we've had a pretty good interest in. We have quite a few horses here to be treated. We'll do vaccinations, we'll do castrations. She even floats teeth. If you get a chance to do that, that's a real interesting process. They put a contraption on their face that keeps their mouth open, and she has a big old grinder, and she floats their teeth, meaning that she levels them out so they have a better eating surface, a chewing surface, and that also contributes to the health of a critter. We've added some pens to our corrals if you like to go have a look-see, and the idea of that is we have better runways and better separation areas, and we also have pens where we can separate the unwanted studs, and then we're also asking owners of these studs, if they're not going to use them as a stud servicing, we'll castrate them for them. If they take them out and we catch them loose, we're going to bring them in and castrate them at the owner's expense, because the vets are only here a certain amount of time. So they leave here with the understanding that if they let their horses run loose and we have to capture them again, there will be costs associated with their recapturing their critters for them. So we've done a pretty good roundup. We've caught horses that haven't been rounded up in years, and some of them are wild, and you might have seen a little bit of that activity here already. But you also see horses that are in pretty poor shape, and you also see horses that you can tell they're well cared for. You know, they're nice and fat, and when you choose to own a horse, a cat, a dog, any kind of an animal, you take on the responsibility of caring for that critter. They don't feed themselves. You take on that responsibility. It's a big responsibility. It's expensive. I saw a bumper sticker one day that said, I used to have money, but now I have horses. I can certainly relate to that because hay costs, horseshoeing costs, veterinary care. So to me, free services like this is absolutely wonderful for the tribal community. And we also have a whole different operation, and maybe you've already been there, dealing with cats and dogs where they spay and neuter the dogs. And I think that's wonderful because we've seen a decline in the population of unwanted dogs.
So what was your name again?
My name's Dr. Karen. How's that?
Okay.
K-A-R-A-N.
All right. And are you equipped to do just about any type of dogs here?
Yes.
Big dogs,
I
small
can do.
dogs?
Actually, I have the equipment to do just about any kind of surgery. So, spays, neuters, foreign body. I've got it all.
How many have you done today?
How many have we done?
This is
Not
number
very
6.
many,
This is 6.
This is number 6. Yeah, it's graduation day, so we came kind of on a holiday day. So now we're going to neuter this dog. To observe, we'll make sure he's asleep enough with some gas.
We also work with Four Corners Animal League and Stray Hearts in helping us keep the numbers in check. They will take little puppies, 6 weeks and older, and then anything left here that hasn't been unclaimed, we'll sell them. And we've already had offers from different individuals that want to buy them. So come check with us on Monday, those people that would like to buy a horse, some of the nicer looking horses. We've got 2 or 3 people interested, so I think I'm going to ask them to submit a bid. Just be fair and see how that works out.
Really?
Yeah.